Thank you for coming this morning, and for the record, I'm Congressman Bill Keating from Massachusetts. I'm joined with my chief co-sponsor, Congressman Hal Rogers from Kentucky. We're going to be joined by Congressman Nick Rahal momentarily, but we wanted to start today's announcements about the reintroduction of the STOPP Act. In America right now, there's a silent epidemic, and it's an epidemic that is taking more lives than automobile collisions are nationwide. It's an epidemic in prescription drug overdoses, and it's also vastly drugs that are opiate derivative drugs. If this were the swine flu or any other kind of disease, this would be making headlines all over the country. But because of the stigma that's often attached to this, it's not. And we're here to speak up so that we can get beyond that stigma. It's a stigma that deals with a misconception that the misuse of these drugs is a volitional act, something you could decide or not decide, and something that's a crime in nature. And as Congressman Rogers and myself, it's interesting to note, we're both prosecutors. And I can speak for Congressman Rogers as well. We don't view this, even as ex-prosecutors, as a criminal justice issue. This shouldn't be the safety net here. This is a public health issue that has to be addressed. Yet it was as a district attorney that I saw in very concrete terms just what happened as we investigated deaths. Time and time again, I saw the carnage that was there with drug overdoses. And these were people that were state police officers that took these drugs after a cruiser collision. These were real estate brokers that were going from open house to open house just to go into the medicine cabinets to try and see if they could get prescriptions. And they were, sadly, a lot of young people who were experimenting the first time and finding the access in the medicine cabinets there for them. And they were beginning to form that addiction, often within days, and often as a gateway to other drugs like heroin. But even with drugs like heroin, the increase in abuse and deaths attached to these prescription drug overdoses are occurring at a rate even more than heroin and cocaine. The STOPP Act is a first of its kind type of legislation, and it deals with the new opiate-based prescription drugs, making sure they're abuse deterrent. Now, some of them already are, but the time right now is a critical time for us to act. In Canada, they've changed the processes so that now generic drugs and all these drugs are now available. They've also, in our own country, one of the two major drugs has already been approved for generic form just in a month or so ago. And in the next 3 weeks, all the oxy-related drugs, those opiate drugs, will be in generic form as well. They're slated for approval. The STOPP Act makes sure they do research to make sure there's tamper resistance protection built in here so they can't be crushed, they can't be melted. And we also want to make sure that we act because the Center for Disease Control has already undertaken a study to see if the effects of this bill requiring tamper resistance in these products will indeed be effective. The early results are very clearly showing that this will concretely save lives. This bill is fashioned so it doesn't compromise the pain treatment that people with terminally ill diseases get, and we make sure also that with FDA, it's going to be done in a feasibly correct manner. You know, if we're in a situation now where we knew the names and knew who would be affected, whose lives would be ruined, whose families would be touched in a way that often can't be healed, and whose lives will be lost. If we knew those names now in advance, you would see immediate action in Congress on this. But we're here with the full knowledge that indeed people will have their lives lost. Parents will lose their sons and daughters and brothers and sisters, and we can act. So it's with that sense of urgency we go forward. I'm just going to show you quickly, graphically, how this works. Besides the crush deterrence that we'll show very clearly here, This drug can't be tampered with in this way. Here's another more typical drug, and you can see the difference. Just that, we've been told by people that have become addicted, that are still in recovery, that just having that kind of protection could have well stopped them from having their addiction. We'll move forward and make sure we do all we can, but we want to make sure that the public will help us as well. We're enlisting the support of many of our colleagues, and we've been joined by Congressman Rahal and Congressman Joe Kennedy from Massachusetts. And now I'd like to introduce Chairman Al Rogers.
Thank you, Bill. I want to thank you for your leadership in putting this together and putting the STOPP Act together, and my good friend Nick Rahal for being a co-chair with me on the Congressional Caucus on prescription drug abuse. Prescription drug abuse, the CDC now says, is a national epidemic. As Bill has said, if this were the swine flu or some common disease of that sort that became an epidemic, there would be headlines across every newspaper in the country. But for some reason, the public is not wanting to admit that we've got a problem with prescription drugs. Over a decade ago, when OxyContin first was approved by the FDA, everyone agreed that the extended release technology was a godsend, a silver bullet, if you will, the next wonder drug for treating people with severe pain. What no one at that time could foresee was what you just saw here, that when you crush those time-release pills, those 12-hour time-release pills, the technology is broken, and a 12-hour dose of a very powerful narcotic pain medicine is released all at once. If snorted or injected, this can cause a euphoric high or an overdose, and in some cases death. This drug is extremely addictive, and once hooked, almost impossible to kick. Tragically, where I am from in rural Kentucky, this happened far too often. Abuse of this crushable drug caught on like wildfire. Instead of being known as a life-changing treatment for cancer or a terminally ill disease, OxyContin was known on the streets as OCs, kickers, Roxys, perks, hillbilly heroin, whatever. In my district, at one time, at the height of this problem, the most dangerous job in eastern Kentucky was not coal mining. It was driving a FedEx or UPS truck, being robbed by people desperate and hooked on OxyContin. Pharmacies were being raided for pills. Once serene small-town communities overridden with crime, their law enforcement overwhelmed, school children being rushed to the emergency rooms, parents being called to the coroner's office. No one could have seen this amount of devastation beforehand coming around the bend when OxyContin was first approved in 1995. But deaths in my district became all too common. Doctors were misled by Purdue Pharma, the manufacturer of OxyContin, who did not warn them about the highly addictive nature of Oxy. A decade ago, Frank Wolf, Congressman Frank Wolf from Virginia, and I went to the FDA hearing in Maryland and testified to beg with FDA to only allow OxyContin to be prescribed for severe pain, not just moderate to severe pain, which they still are allowed to prescribe for. But we were almost laughed at, certainly ignored, and the label is still there. Doctors can prescribe OxyContin for moderate to severe pain. But now it's different. We know the devastation that uncontrolled use of OxyContin can have upon people. We must not ignore history, especially history so recent as we have experienced. We already know what will happen if the FDA allows crushable generic pills to come back on the market in the U.S. You've just seen a demonstration of the difference between a crushable and a non-tampering, a tamper-proof pill. That's what the FDA needs to see. The wave of senseless addiction that we can already see coming from a mile away, if cheap crushable pills are reintroduced to the market, it's completely 100% preventable. I'm not shy about saying that I'm no fan of companies like Purdue Pharma. They've known for years that there is a high propensity for their product to be misused, and yet they left crushable OxyContin on the market for 10 years, generating $3 billion in profits and leaving a wake of devastation. And as you know, in point of fact, they were convicted in criminal court. The officers of Purdue Pharma convicted in criminal court for misleading the public and doctors on the danger of crushable OxyContin. They paid a fine of $600 million. Only now that the company's crushable pills have been replaced with a new formulation have these pill pushers acknowledged the dangers associated with their product. It's a day late and thousands of lives short. But in this instant, Purdue does speak the truth, even if its motives are somewhat questionable. FDA has the authority to prevent generic crushable OxyContin from reappearing in young people's parents' medicine cabinet. They agree that if the original OxyContin was removed from the market for safety reasons, quote, they can deny new generic crushable opioids. In my state of Kentucky, we saw overdose deaths from crushable Opana ER increase by 540% in a year when tamper-resistant OxyContin came to market because addicts were seeking an alternative high since OxyContin became non-crushable. While incredibly tragic, that does show us that the tamper-resistant formulations are working, though I'm not naive enough to believe they're a silver bullet. So we need to keep the crushable drugs from coming back in cheap, generic form. Now is the time for FDA to act before deaths begin to mount again, before hopelessness and addiction ruin more lives, families, and communities. I've been pushing the FDA for months, even years, to make the right call here. And the FDA has confirmed that they have the authority to keep these crushable pills out of our kids' hands. But time now is of the essence. And if the FDA will not act boldly, the Congress will, with a STOPP Act. That's why we're here. I'm proud to be a co-sponsor of this bill, which I think will save lives and promote innovation. And I'm glad to be associated with my friends who share these beliefs with me at the conference today, including Mr. Kennedy. Thank you for being here as well. Mr. Rahal.
Thank you. Thank you. Thank you very much, Chairman Rogers. I appreciate you and my colleagues, Bill Kennedy and Joe Kennedy, Bill Keating, sorry, Bill Keating and Joe Kennedy for
I can share in
joining
the
us.
trust, I'll be okay.
Certainly, Chairman Rogers is to be commended for his efforts in this regard. He and I are co-chair of the Prescription Drug Abuse Caucus in the Congress. We also share congressional districts. A lot of what he has described that's occurring in his district is occurring in my district as well. In a sense, we are ground zero for this drug epidemic. And when the word epidemic is used by CDC, it's not used lightly. That term is a very major term, and what we're doing today is an effort to address this epidemic. The legislation that Bill Keating has introduced, known as STOPP, seeks to stop drug manipulators and start drug manufacturers thinking and working on a way to keep pills safer, even in the hands of the most evil intentions. In the end, this bill will save lives, save medical resources, save hospital beds, save prison cells, broken homes, and orphaned little ones. It will save commerce in all levels of government, billions of dollars, because we know what this epidemic is costing our economy on an annual basis. Yes, that means savings to our taxpayer, because in every one of these issues, in the long term, you're talking about costs to the American taxpayer who will foot the bill to correct a lot of these abuses. So we're all paying a multiple million-dollar price tag for this terrible epidemic that impacts everyone, whether you are 9 or 90, whether you are rich or poor, whether you are a doctor or a carpenter. This affects everybody. No matter where you live, this epidemic is far-reaching. Drug abuse negatively impacts our workforce. It requires millions of dollars for national and international interdiction, and it may be the biggest challenge facing our society today. It's a difficult and challenging path to try to save an entire generation. Our nation's future, our children, and our grandchildren's future all hang in the balance. You've heard the statistics for Eastern Kentucky, my colleague Hal Rogers. Sadly and tragically, drug overdoses kill more West Virginians than car accidents. Between 0.1 and 0.8, the statewide death rate by prescription drug overdose more than quadrupled. West Virginians are more likely to die from prescription drug abuse than residents of any other state. Indeed, the flood of pills available in rural America and on our streets is astonishing. It's been estimated in West Virginia that we lead the nation in prescriptions written, an average of 18 prescriptions per person. We know that there's no one answer, as Hal Rogers has said, no one silver bullet that's going to solve this epidemic. But we do know it's going to take a national strategy, all of us working together, whether it's private sector, public sector, whether it's educators or parents. It takes all of us working together harder than ever. Legislation alone is not going to solve the problem, because we know that legislation cannot keep pace with the changing drug trends as clinics pump out thousands of units of controlled prescription medications, all within the current law at the time. Treatment cannot keep up with the needs and demand in our communities, so the only way we can start addressing this epidemic is to address the supply problem, to limit the supply. Treat what you can with services available and focus on the prescription and prevention of new issues. We must address drug diversion by educating our children, educating our adults, educating our communities, education at all levels. We must work with the medical community, with our pharmacists, on the addiction and pain treatment, both for those who prescribe the drugs and the pharmacies that fill those prescriptions. And drug manufacturers must do their part to ensure that their products are used properly and safely. The STOP Act is an important step. It is a part of that comprehensive national strategy in the fight against prescription drug abuse. Making these pills harder to abuse is a needed step in curbing the abuse and overdose levels that we see in West Virginia and all around the nation. I again commend my colleagues, and I commend each of you for being here and showing that you are concerned as well about this issue. Thank you. Joe.
Congressman Kennedy.
Thank you. To my fellow member of the Massachusetts delegation, Congressman Keating, to Chairman Rogers and Congressman Rahal, thank you very much for your incredible advocacy on this issue and your leadership. As a former prosecutor in Massachusetts, and actually one of the counties that Congressman Keating now represents, became acutely aware of the challenges and the incredible consequences of prescription drug abuse, not just from those suffering from addiction, but their families, the families of those who are victim of ensuing crime, and how that spreads throughout communities. And it's the reason why this issue is so complex, it is so complicated, but it's also why this act today is such an important step forward. And I want to applaud Congressman Keating for his leadership here in Washington, but really for his long-standing advocacy on this issue back home in Massachusetts as a district attorney, member of the State House, and now as a member of Congress. This, as Congressman Rahal said, is an issue that affects not just those who happen to be suffering from addiction, but so many members of our society. It does not target rich or old, young or old, rich or poor, Democrat or Republican. It targets so many of us in ways that you only become aware if you start asking some very tough questions. And I, for that reason, today applaud their leadership and look forward to working with them and supporting them in any way I can. Thank you.
From the Community Anti-Drug Coalition of America, I'd like to introduce Mary Elizabeth Elliott.
Good morning. I represent CADCA, Community Anti-Drug Coalitions of America, which supports over 5,000 local coalitions that fight every day to make communities safe, healthy, and drug-free. It is a great honor to join these congressional leaders who have been champions for drug abuse prevention and our partners at CLAD to express our support for the STOPP Act bill. As the nation's leading substance abuse prevention organization, CADCA has been addressing this issue for more than a decade. Prescription drug abuse is a grave concern and a complex problem. Anyone who's had a loved one in chronic pain knows that prescription drugs, such as opioids, can provide valuable treatment, enabling people to function, work, and care for their families. However, these drugs are powerful narcotics with a high abuse potential, and that is why we have on our hands a serious and deadly epidemic. The CDC reports that enough prescription painkillers were prescribed in 2010 to medicate every American adult around the clock for 1 month. With so many pharmaceutical narcotics available, the potential for abuse is something we all must face. This morning, thousands of parents started another day without their son or daughter due to prescription drug overdose. As a nation, we must do all that we can to reduce these tragedies. Now, many CADCA coalitions are using a multifaceted approach at the local level that includes education and awareness, increased community engagement, efforts to address access and availability, proper disposal programs, and support for better reporting and prescribing practices. Their efforts have shown positive effects, but additional strategies are needed. Formulation-based deterrents are another important piece of this puzzle. CADCA believes that all drug manufacturers, generic and branded pharmaceuticals, should follow formulations that deter abuse potential. That is why we support H.R. 486. CADCA also supports ONDCP's plan to reduce prescription drug abuse, and increasing abuse deterrent formulations is a recommendation there as well. Just this week, 48 state attorney generals signed a letter to the FDA urging that all manufacturers of prescription painkillers include abuse-resistant properties. This underscores the need to move quickly in both policy and education to curb misuse and abuse while allowing pain medications for individuals that need them. I applaud Representatives Keating, Rahal, Rogers, and Kennedy, and the other co-sponsors of this bill for their commitment to reducing prescription drug abuse. I just wanted to let them know, and all of you, that CADCA is in the fight with you. And we pledge to continue to do all that we can to protect young people from drug abuse and make our communities safer and healthier. Thank you. Thanks.
And finally, from CLAD, its founder and executive director, Michael Barnes.
Representatives Keating, Kennedy, Rahal, and Rogers, and my colleagues at CADCA, thank you for your veritable commitments to reducing prescription drug abuse. The Center for Lawful Access and Abuse Deterrence, CLAD, is a national nonprofit dedicated to reducing prescription drug abuse while protecting patient access to care. I'm Mike Barnes, Executive Director of CLAD. Pharmaceutical companies must take responsibility for the safety of their products. That's what the STOPP Act is about. It's really that simple. Some companies have heeded the public's call to improve their product safety. They voluntarily removed their pain pills from the market and replaced them with new versions designed to thwart common forms of abuse, like we saw. In transitioning to tamper-resistant medications, drug companies have slashed their products' rates of abuse. Tampering and abuse have decreased by 71% in one case and 59% in another. These new abuse-deterrent products cost no more to consumers than their prior formulations. But our progress is in jeopardy because in January, the FDA granted approval for a traditional, more readily abused opioid formula to come back to the market in cheaper generic form. Anecdotal evidence from law enforcement indicates that abuse of the non-abuse deterrent product is already severe. If Congress does nothing, the old, abuse-friendly variety of oxycodone can be expected to reach our communities as early as April 16th. That's just 1 month away, and that's why we need the STOPP Act now. The STOPP Act will prohibit any old formula opioid from entering the market if the FDA has approved an abuse-deterrent version of the therapy. It codifies industry's moral obligation to make products safer. The bill is better than bipartisan. It's nonpartisan. Generic drug makers will have you believe that passing this bill will keep generic drugs off the market. And that's not the case. Passing the bill will keep easily abused drugs off the market. Generic makers may create their own abuse deterrents or license tamper-resistant delivery mechanisms from other drug companies. Industry has already shown that it's possible to make pills safer without significantly increasing prices. The issue is this. Approving easy-to-abuse drugs when abuse-deterrent forms are already available will annihilate the budding market for innovative, safer medications, and the consequences for families and communities will also be fatal. The STOPP Act provides a shift in the market in favor of safer medications, both brand and generic. So members of Congress, all of you, beyond the leadership here in the room, we urge you to pass the STOPP Act before the easy-to-abuse oxycodone flows back into our communities on April 16th. Thank you.
That concludes our presentation. I just want to mention that what all our speakers have mentioned, time is of the essence here. The flood of generics is coming to our country. It's at our borders in Canada, and it's already here in some forms of approval just a few months ago. Lives will be lost, lives that could be saved. Because the FDA has not acted, Congress is prepared to do so, and we'll need your support. So thank you very much. If you have any questions, we'll be glad to answer them. Thank you.
That's it.
No questions?
Good. Good. Good work.
Chairman Rogers, just wanted to say hello. Thank you for all your support. And CADCA, General Dean wanted to be here.
I know.
He is in Vienna because this is the week for the UN Convention on Drugs, and he was representing the NGO committee there. But we'll be